All right, so here we are in one of my favorite segments of the Know Your Rights brochure. It's a passion of mine, mental health. Mental health defined. Mental health is so important. And one thing I believe personally, and I always say this, is people don't know the necessity of mental health care until you have effective mental health care. So whether it's a counselor, a psychiatrist, therapist, you don't know the necessity of it until you have an effective one of it. And so in this segment, we're going to be talking about mental health and the difference between a therapist, psychiatrist, counselor, and I'll probably be sharing some of my experiences with mental health because, I love selling mental health. I really do. More than anything. More than the things I make, because I have seen the personal positive manifestations of effective mental health care. So let's get into it. So when we talk about mental health defined, we talk about mental health. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. And it also helps determine how we navigate stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence to through adulthood. Always remember, our mental health is directly connected to our overall health. Our physical and emotional health definitely impacts our mental health, just like our mental health will impact us physically and emotionally. Our minds, our bodies, and our spirits are all connected, so taking care of one part of it is important for overall wellness. Please remember, it is okay for us to focus on or prioritize our mental health. It is not selfish or wrong, because all of this impacts us, especially with mental health providers. It is important for us to know what medications they are prescribing. With any medication, make sure to ask what the side effects are, as well as how they mix with other medications. If you have a chronic condition, ask if studies have been done of the impact of said medication on people living with specific conditions. Keep a journal to document side effects. Record any differences if medication is taken with certain foods, time of day, etc. An accountability partner is someone who holds you to and supports you in keeping a commitment. Usually a trusted friend or an accountability partner is not there to force you to do something, but remind you to check in with about the commitment, including maintenance of the commitment, whether it's taking medication, adhering to visits, knowing when to reach out for support. An accountability partner can be helpful on a journey to mental wellness. And yes, I actually just had our friends. If you have a friend, sometimes your friends are that, because I remember saying something a while ago about what I wanted. And I said something about emotional intelligence. Like I wanted somebody, like my next partner, I wanted them to have a high level of emotional intelligence. And then not too long ago, I was told by a friend, remember Chad, because I was talking to somebody and they were like, remember Chad, what you said, you wanted somebody with high levels of emotional intelligence, and you can ask yourself if this person meets that. And so accountability, and it's like, even when we forget, sometimes our friends don't, and they're able to, whether it's intentionally, if you ask them to be accountability partners or not, they will hold that up to you or bring that up to you like, hey, remember this. So yeah, a PEC, Physician's Emergency Certificate, is issued after a mental health professional has determined that a person is a danger to themselves or others and is unwilling or unable to admit themselves into a facility. When a PEC is issued, it means that you can be held without your consent in a hospital or mental health facility for up to 72 hours. To detain you longer than 72 hours, a coroner must examine you and can issue a CEC, which is a coroner's emergency certificate, if it is determined that you are still a danger to yourself or others. With a CEC, you can be held against your will in a mental health treatment facility for up to 15 days or until discharged by a facility. So, a therapist versus psychiatrist versus counselor. So, we talk about the differences in mental health professionals. This is going to break down what those differences are. So, a counselor works with you to determine the best ways for the best way for the sessions to achieve the preferred outcomes. So, if you go into a session saying, like for me, I would say a lot of my returns to mental health or to counseling therapy has been centered around a loss. Whether it was the loss of my mom, loss of a relationship, loss of a cat, my animal, all those things. And so it's always good when you do approach therapy, counseling, which they're probably, a good therapist is going to ask you, what do you want to achieve out of this? Because they want to be able to guide you to that other side. But it's good to know going in, how you want to answer that question. What is it you want out of this therapy session? And move intentionally in that, even sometimes when it may not be easy, because I will say in therapy, my experiences with therapy, it's not always easy. You face some hard truths about yourself sometimes or about a situation. And you have to, in order to have effective therapy, effective counseling, you need to go in there being honest, being transparent, because that's the only way you're going to get the best benefits out of it, So yeah. So counselors work with you to determine the best way for the sessions to achieve the preferred outcomes, being a more short-term alternative to therapy. The term counselor can include diverse groups such as clergy and other spiritual advisors. Counseling focuses on specific issues and is designed to help you address a particular problem, such as an addiction or stress management. Seeing a counselor who is not a licensed therapist may be cheaper, but you may not have confidentiality by law, so make sure you do extensive research on the counselor before sharing intimate details about your life. Therapists use a behavioral approach to therapy. It is more long-term than counseling and focuses on a broader range of issues. The underlying principle is that your patterns of thinking and behavior affect the way that you interact with the world. Sometimes those patterns are picked up quickly. Sometimes they're picked up over the course of a few sessions, several sessions, because I've had my therapist call out patterns that she's seen with me, or the way I say things seems to suggest the way I view things and whatnot. So, and this is why I said in the other video, I think about wellness, about journaling being another effective tool to have in your toolbox, because journaling, especially if you bring it into therapy as a basis sometimes to talk to, journaling can kind of help your therapist pick out certain patterns and stuff that may be happening that you may not be even recognizing, and so again, having multiple tools in the toolbox. So the goal is to help you feel better equipped to manage stresses, understand patterns in your behavior that may interfere with reaching personal goals, having more satisfying relationships, and better regulate your thinking and emotional responses to stressful situations. And then there's a psychiatrist. A psychiatrist is a medical doctor who specializes in preventing, diagnosing, and treating mental illness. A psychiatrist is trained to differentiate mental health problems from other underlying medical conditions that could present with psychiatric symptoms. They also monitor effects of mental illness or other physical conditions such as problems with the heart or blood pressure, and effects of medicines on the body such as weight, blood sugar, blood pressure, sleep, and kidney functioning. So, choosing and changing therapists. Finding the right mental health professional and approach to therapy is as important as finding the right doctor. Once you find a professional, start with a phone call to the professional. Ask about the professional's approach to dealing with mental health issues and how that person generally works with clients. And ask about whether or not they accept insurance and how payments are handled. If you are satisfied, describe the issues you are experiencing and see if they are experienced in such issues. And so, I think that is it as far as the text. But continuing on, yes. So here is something that I find a lot, in talking to people. Finding an effective mental health therapist. Sometimes it works right away. You may get it right on the first time, and sometimes it doesn't. And I think a lot of people, it's just like, it's no different than you finding the right mechanic to fix your car, or you finding the right barber to cut your hair, you finding the right stylist to dress you up. You have to, sometimes it takes time. It's not always just as clear cut because you have so many therapists, you have so many different, and each therapist has different approaches. Some are similar and some are different. And so I think it's okay to recognize that, hey, this therapist is not working for me. And I think it's okay to call that out, because I know with a couple, my last two therapists that I've worked with, the one I work with now, amazing. I love her. I do. And it's to the point, she doesn't accept my insurance anymore, but I pay out of pocket for it now because she is very skilled. Her specialty is grief, and so, and that's one of the things that has been prominent in my life is grief. And so you have to, so what will happen is a lot of the times, the last two therapists I've been through, they'll set up a consultation session and you talk to them and you go through your issues, and it's almost to me like you're sampling the product, to see if this person or this therapist approach can be effective to what you're experiencing. And if it is, I think that's great. Run with it. If it's not, I also think, just like we talk about our primary care providers, our healthcare providers, I think it's also okay to recognize that and pivot. And I feel like an effective or a good mental health therapist is going to be okay with you saying, hey, I don't think your method of therapy resonates with where I am right now. Could you help me find another, what are some other suggestions? Could you send me a few referrals to somewhere else, And because when I did leave, originally I was going to leave my current therapist, and I told her, I said, in this stage of life where I'm at, which I'm still not hung up on that thought, I want a Black gay mental health therapist because I want to be able to talk about some of the things that I experience, and I want them to be able to offer a perspective from us through a similar lens that they see life, that I see life through. You know what I'm saying? And so, just being open and honest with, whether a therapist works for you or not. And then the other thing I wanted to add too is difference between a therapist and a psychiatrist. I feel like psychiatrists are more like focused on the medical aspect of things, and sometimes, like last year, I went through a very serious bout of depression, very serious, and it was to the point where I had suicidal ideations. And I was going through my breakup last year, through my breakup, and just going through the ebbs and flows of it. And when I would get to the top, some days I wake up and I feel like I'm at the bottom again. And it wasn't just the breakup, it was just everything that's going on in the world, politically, economically, and whatnot, and me taking on those things on top of what I was dealing with internally. It really took a toll on me. And so I went to therapy every week of the year following my breakup. I made that commitment to show up for myself, even in times when it wasn't easy. And so I say all this to say, in one of the sessions, we were talking, and I think I probably was talking about my frustrations on why mentally I couldn't get to a better place, on why the depression wasn't leaving. And so, and I laughed because I laughed at my reaction. She said, have you ever thought about how would you feel about a psychiatrist? And I was like, I had a very, very strong reaction at first. Like, she had to, reel it back. I was like, no. Basically, I was like, oh, no. And I think, that reaction came from how we as a society are conditioned to seeing mental health professionals like psychiatrists and therapists, like, something is wrong, we're off, we're out of our minds, this and that and the other, And so when I told her no, she said, hear me out. Sometimes it takes all the tools in the toolbox, which is something, that's where I got it, the toolbox thing from, I got it from her. And sometimes it takes all the tools in the toolbox, and sometimes, this may not be a permanent thing, but what I'm asking you is to be open to at least considering it, and because psychiatrists can offer something from a different perspective than I can. I'm speaking her the way she was speaking to me, whether, they needed to diagnose me with depression, or even if it was this, because we have conditional or temporary or situational depression, and sometimes it may take, medication on top of the regular therapy sessions to be able to get to the other side, and it may not be a permanent thing, And I know a lot of people talk about like the medications and some of the side effects and whatnot, but again, a psychiatrist is there. A good psychiatrist is going to monitor you through those steps, because they want to see how that medication is working and how you're functioning with it, and if they need to pivot it, so that you're going to have like those appointments close together, at least in the beginning, while they see, how you're feeling mentally, how you're functioning physically, emotionally, all those things. So, in closing, again, I'm going to end where I started, which was, mental health care is a passion of mine, and people don't realize how important it is until you've had the effective care. And for me, even still, you don't have to have like all these life-threatening things going on to seek therapy. Have one there. If you need to talk to them once a month, just go every once in a while just to work things out, because we as people, we're taking things in. Our minds take things in from day to day, and sometimes we don't always realize the effects of the things that we watch on TV, take in on social media, experience from people in the outside world, not always being kind to us, being mean, being impatient. We don't realize the subliminal or subconscious effects sometimes that can have on us. Sometimes, not all the time, but sometimes. But that is why it's so important to have a therapist in your tool belt. And so I leave you with that. Taking care of yourself mentally, it's paramount, especially in the times that we're in right now. But always, having it in a tool belt and having someone there to guide you, because life's a journey. It's an endless journey, and you are always going to be dealing with something, and I'm not saying that in a negative way. Life is an experience, and in life you have positive experiences and you have experiences that aren't so positive. And so it's always amazing, a beneficial thing to have someone that is, that can help shine a light or help guide you or help you help yourself help you guide yourself through things. And I can speak time and time again about the effectiveness and how it's helped me navigate grief, finances, relationships, loss, abuse. And I thank God for it, and I thank God, as it all started, after I lost my mom in 2007, and I had to take a leave from Loyola because I was maybe in my second to last year there, and they were like, well, in order for you to come back, you have to see a counselor, and that counselor has to sign off on your readiness to come back to the university. And I was so thankful Loyola did that, because I don't know many universities that would have took that amount of care in one individual's grief to see them through, So, yeah, anyway, that's it. I hope you enjoyed the video. Make sure you like, comment, subscribe. If you see this on Facebook, follow us on YouTube. I'm sure the link, I'm pretty sure I'll share the link. The link will already be on Facebook, so when you click on the video, it'll bring you to it, but to our YouTube page. So yeah, because we'll be posting more videos like this, and you can see some of the other videos, and make sure you share them with someone that you think may benefit from things like this. Don't gatekeep it. Don't gatekeep. Share. Knowledge is wealth, and knowledge is meant to be shared, and so if you think this will be beneficial to somebody, please share it, okay? Make sure you all take good care of yourself. Make sure you take good care of yourself, and if you know somebody who is dealing with some things, some challenges with mental health and whatnot, send this to them. And also feel free to share, to reach out, we may not be able, depending on the situation, the person, the circumstance, we may not have direct access to mental health providers, but I may be able to send you something to steer you in the right direction. And at the very least, especially if you're in Georgia and Louisiana, I can at least send you a couple of therapists that can help get you started on the mental health care journey if you haven't already, okay? All right, take care of yourselves, and I will see you soon. All righty, bye-bye.